Pleasant and healthy good afternoon to all, and welcome to a live press conference being called by the Ministry of Health and Wellness in partnership with the Attorney General's Ministry and the Ministry of Home Affairs and New Growth Industries. This press conference is being called to update the public on specific quarantine measures. To start, I'd like to introduce our head table. At the center of the head table, we have the Minister of Health and Wellness, Honorable Michelle Shebat. To my immediate left, the Minister of Home Affairs and New Growth, Honorable Karim Musa. To my far right, the Solicitor General of Belize, Ms. Elisa Montalvo. Without further ado, I'd like to call on the Minister of Health and Wellness, Honorable Michelle Shebat, to provide opening remarks. Minister Shebat.
Thank you very much, Honorable Karim Musa, Ms. Elisa Montalvo. Ladies and gentlemen, good afternoon. Since the last statutory instrument came into effect on December 17, 2020, the Ministry of Health and Wellness has made great strides in curbing the spread of COVID in Belize. Let me congratulate all of our frontline workers, including our policemen, for the hard work that they are doing to keep our population safe. I especially want to thank our acting DHS, Dr. Melissa Diaz-Musa, and her team at the Ministry of Health and Wellness, who have been doing an incredible job. The government is now able to lift the inter-district ban that we placed on the Corozal and Orange Walk districts, and we are now able to modify some of the containment measures that were put in place to contain this disease. But we could not have done this without the cooperation of the general public. I have been saying since I took office that this disease is spread by human behavior. And so we see that due to human behavior or misbehavior, our numbers start to increase. Then we will be forced to take strict measures to get our numbers back down. Since expanding our testing, we have seen a decreasing number of cases, but at the same time, we have also seen a decreasing number of persons accessing our testing services. This may be a reflection of the containment of the outbreak, but we can only be certain of this if we reach out to more people and consistently get less than 5% positivity rate for 2 incubation periods or 28 days. With that in mind, we have commenced testing at high-risk institutions, meaning institutions whose employees have a higher level of interaction with the public. These institutions include, but are not limited to, the government ministries and departments, institutions that house the elderly, the BDF camps, banks, call centers, media houses, and big industries, as well as supermarkets. Shortly, we shall also be knocking on your doors. We will be going house to house to make sure that we identify all of our citizens who may be afflicted by this virus. So I implore you to continue the great job you've been doing by continuing to adhere to the public health recommendations. Wear your mask, practice social distancing, wash your hands, and do not congregate unless absolutely necessary. Please bear in mind that we cannot afford to let our guard down. We are not relaxing. We are only modifying. Don't be afraid to get tested. Continue to access our testing sites and let us keep our population safe. Since Epi Week 51, which is December 13 to 19, 2020, to Epi Week 3, which is January 17 to the 23rd, 2021, we have seen a steady decrease in positivity rate from 20% to 10%. For example, in December, in the Belize district, we had 1,073 cases. In January, that is now down to 348. In the Cayo district, we started at 983. We are now down to 273. In Corozal, 492. We're down to 62. In Orange Walk, 625 cases. We're now down to 66. In Stan Creek, 452 cases, and we're now at 128. And in the Toledo district, we started at 368. We're now at 152. Our numbers have fallen significantly over the past months, but this is not the time to let down our guard. Across the world, there is now a third wave, and recently we have seen lockdowns in Barbados and Trinidad and Tobago. We at the Ministry of Health and Wellness continue to be vigilant, and we will use this time to prepare for the third wave, which will inevitably reach our shores. In this regard, just a few words on where we are in relation to the vaccine. As we have said before, Belize is a part of the COVAX facility, and we are expecting receipt of the vaccine in country either by the end of the first quarter of this year or by the early part of the second quarter of this year. So we're looking at possibly March to April. However, we're not just relying on the COVAX facility, but we have also entered into bilateral discussions to access other sources of vaccines. We also expect through the Ministry of Health and Wellness to shortly commence our campaign, our education campaign on the vaccines. And so, ladies and gentlemen, again, while at this point we are able to relax some of the measures we had implemented, we ask that you continue to be vigilant. We ask that you continue to adhere to the public health stipulations that we have in place. We ask that you don't hesitate to come out and get tested. It is important for you to participate and for you to continue observing these regulations. Ladies and gentlemen, at this time, I would like to ask the Honorable Karim Musa to address you on the particulars of the new SI. Thank you very much.
Good afternoon, Minister of Health and Wellness, the Honorable Michelle Shabat, our Solicitor General, Ms. Elisa Montalvo, ladies and gentlemen, members of the press who are joining us this afternoon, and Belizeans at home and abroad. We are here this afternoon, as you know, to adjust and to modify some, not all, of the regulations that have been in place since December 17, 2020. Regulations which no doubt have had a significant impact in slowing down the virus, slowing down the spread of this virus. I think I have to repeat and echo the sentiments of the minister in saying that we cannot let our guards down. While it is that we will be modifying some of the measures today, we must at all times be mindful of our personal and corporate responsibility as we move forward as a nation dealing and addressing this virus. It is oftentimes said that it takes two to tango, but it also applies that it takes two to infect. So each and every time you walk out of your house, you have to still wear your mask every time you walk out of your house. When you go into a supermarket, try your best to resist the urge to gather in close proximity with your friends and family. Continue to buck each other with your elbows and not shake hands. I see most Belizeans have been doing that. And so I want to take this opportunity, Minister, to thank all of your frontline staff, all of our healthcare professionals who did a phenomenal job between December 17th and where we are today, seeing a reduction in the number of cases. And of course, to thank the members of the police department who have been charged with enforcing the regulations. So to all frontline personnel, we say thank you. And of course, to all Belizeans who have been patient with us, very patient with us, very understanding, and have been abiding strictly by the curfew and all the other regulations. We could not have seen this dramatic turnaround if it were not for your compliance. And so we thank you for that. I will go through the regulations. Like I said, not all regulations are being modified, only some, and I will now go through each of those that will see modification. The first adjustment to the statutory instrument is that curfew is now going to be from 10 p.m. to 5 a.m. So it's no longer going to be 8 p.m. Curfew starting February 1st, Monday, will be at 10 p.m. and will go to the following morning until 5 a.m. This curfew applies to adults only. The 10 p.m. curfew applies to adults only. The curfew for minors continues in effect from 6 p.m. until 5 a.m. the following morning. So the curfew for minors remains in place, while the curfew for adults is now 10 p.m. to 5 a.m. In relation to gymnasiums, I know a lot of people are eager to get back and exercise, and I'm sure that the Ministry of Health and Wellness would want you to exercise, but they want you to exercise in a very responsible manner. And so we are altering the regulations as it pertains to gymnasiums. Gyms can now open, and they are to operate at a 50% capacity at any given time. So similar to restaurants, gyms can also operate, but at 50% capacity. The gym must, like restaurants, must be properly ventilated. Gym owners have an added responsibility that they are required to keep a log of the name, contact number, and temperature of persons who are attending the gym. So this responsibility of logging this information falls on the gym owners and gym operators to take this information. So you're logging the name, contact number, and temperature of persons who are attending your facility. The gym owners and operators are also required to sanitize regularly, sanitize all of their equipment after each and every use. So if one individual is using it and then shifts over to another machine, the gym operator is to ensure that the equipment is sanitized before another person uses that particular piece of equipment. And finally, in relation to gyms, attendance at the gym must be by appointment only. So you have to have an appointment if you're going to the gym. And again, that will help the gym owners to ensure that they are not going above and beyond the 50% capacity rule that is now in place. Similarly, churches can now operate, can now open to the public, and the capacity likewise for churches is 50% at any given time. In addition to that, the service, we are asking by regulation that the service does not go beyond 1 hour in time. So if you're having a service at 9 in the morning, it has to be finished by 10 in the morning. Of course, you can have another service in the evening, but again, it will be restricted to a 1 hour church service. So that is good news for the churches. But again, please be mindful, we are requesting, and it is a part of the SI, that you cannot go above 50% capacity. Another regulation that will be adjusted is the regulation that pertains to food vendors. Previously, under the last SI, it was part of the regulation that food vendors can operate, but that they can only do so from private property. That is now changing under these new regulations. So food vendors are allowed to operate without the need to be on private property. So you can operate at different locations, not necessarily on private property. I want to remind food vendors, however, of the regulations which speak to setting up markers around your vending station. So this applies to all businesses. When individuals and customers are going into a business, there are 6 feet markers that are outside of businesses. And we are asking food vendors to do the same so that the customers of the food vendor can maintain 6 feet distance from each other while they're waiting to be served. As you had been informed previously, on February 1st, the free zone, the Corozal free zone, will be reopened. And the board of directors of the Corozal free zone are to ensure that there are temperature checks of every person entering the Corozal free zone, and that temperature check is taken and logged. So similarly to gymnasiums, the responsibility falls on this occasion on the board of directors of the Corozal free zone to keep proper records, logging and taking the temperatures of the customers coming into the free zone. Likewise, owners and managers of businesses within the free zone are to abide by any guidelines that the Ministry of Health and Wellness may issue prior to conducting business in the Corozal free zone. As I understand it, Minister, the Ministry of Health has been carrying out an examination of the businesses in the free zone, and they have been ensuring that these businesses are properly equipped in order to receive customers. And so once the Ministry of Health has checked your premises, they then issue a certificate of compliance. And then that way your business can open starting on Monday, February 1st. So Corozal Free Zone is going to be reopened. Very strict guidelines that they will need to follow. And the Ministry of Health, along with the Ministry of Home Affairs, will be monitoring the progress in the Corozal Free Zone. Another change that is coming under these regulations, on the last occasion of the House of Representatives and the National Assembly, we had proposed the issuing of violation tickets. As you know, under the previous quarantine regulations, members of the public were subjected to being detained if they were not wearing their masks or if they were breaching other parts of the regulation. They were taken to the police station, they were processed, they were told to return to court the following day, and that resulted in an overcrowding, not just of the police station, but also of the courthouse. And so we saw where that in itself could be a potential super spreader, and hence the reason we decided to move in the direction of the issuing of tickets for offenses. And so these new regulations under the Public Health Safety Act provide for the issuance of violation tickets for breaches of Regulations 4, which pertains to the curfew. So if you're out after 10 p.m. and you are caught, you will be ticketed and you will be fined $500. The wearing of masks is also a violation that is ticketable. Social distancing protocols. Now, I know over the last few months, some of us may have gotten a little relaxed when we're out in public. Again, please be mindful that we are to remain 6 feet apart from each other. And if you are not practicing social distancing when you are out of your house, you can be ticketed. So please be mindful of that. If you are engaged in contact sports, you can be ticketed. All individuals on a basketball court or on a football field or rugby, I hear rugby is being played, that will be a violation and you will be ticketed. And each and every person likewise will be charged $500. A ticket of $500 will be issued to them. The various compliance with the health and safety protocols of persons entering through the airport. Example, wearing your masks in the airport and observing social distancing when you're coming into the country. Those individuals, foreigners and locals, are subjected to the very same requirements, and so you can be ticketed from that standpoint of entering the country and not observing the regulations. So you can likewise be ticketed and fined $500. As the minister indicated earlier, the restriction of movement between the Corozal and Orange Walk districts has been removed. And so there is no longer this restrictive movement, at least not as of February 1st. That is not to say that we will not have to come back in the near future if there is a spike in any district, not just Corozal and Orange Walk. In any district, if there is a spike, we might very well have to come back to the Belizean people, and we might have to put in stricter regulations. I understand where we are today, and it is a very seesaw, roller coaster situation, and there is always this tug of war between health and business. We understand that. We hear the cry, particularly from the tourism sector, San Pedro and Kikaker and Placencia. We are winding down on the high season in those locations. And so we hear the cry that we would want to have the curfew lifted, adjusted to 10 p.m. And so we understand that, but we have to be mindful when we look at Jamaica and Barbados. Those other jurisdictions are locking down. And so it is incumbent on us. We are getting somewhat of a relaxation of the measures. And so while it is that many are able to appreciate that, we also have to be mindful that this thing can, like I said, have a seesaw effect, and it can go up quickly, in which case I am sure the Ministry of Wellness, Ministry of Health and Wellness will take very swift action, as they have done quite effectively in curbing and slowing down the spread of the virus since December 17, 2020. And finally, on the sale of alcohol, like I said, a lot of the clamoring came from the various tourist destinations, saying that, in fact, a lot of their guests would want to be able to dine in and have a drink or what have you. And that is why the sale of liquor has been extended. So there's no longer the 6 p.m. requirement, but now it is 10 p.m. But let me make this very clear. Like I said, that only pertains to restaurants and shops. If your shop license says that you can only sell alcohol until 9 p.m., that doesn't mean you can take advantage of the new regulations and sell until 10 p.m. Absolutely not. So if your shop license is 9, that is the cutoff time for selling alcohol. Bars, casinos, nightclubs, all of those remain closed. So none of those businesses are allowed to operate during the term of these regulations. So again, it is simply to allow restaurants and shops to be able to sell up until 10 p.m., the ending of the curfew. So you cannot sell alcohol after the 10 p.m. because there is a curfew in any event. And so I believe those are the changes. Again, I cannot emphasize enough the importance of wearing your masks. All other restrictions remain in place. You cannot have parties at your house. You cannot have more than 10 people at your house. You cannot arrange for a gathering of 10 people at your house. And so these offenses still carry very strict penalties. All of the regulations as it pertains to BPOs and other businesses, the call centers still remain in place. All of them, all regulations, they are unchanged. Businesses are still required to have a shift system in place, still there. The restrictions that were previously imposed on spas and salons and barber shops with the restrictions of setting appointments still remains in place. And so those are the changes, like I mentioned, as we move forward now. There is somewhat of a relaxation, but again, at the end of the day, it is incumbent on us, the citizens, to take personal and corporate responsibility as we move forward in the enforcement of these new regulations. So if you have any questions, myself and the Honorable Minister will be available to address those concerns. Thank you.
Thank you to both the Minister of Health, Honorable Michelle Shabat, and the Minister of Home Affairs, Honorable Karim Musa. At this time, we will be inviting questions from the media. They have logged in virtually through the government press office. Yes. We will be allowing for 2 questions in this first round, and thereafter, if any media house would like to ask an extra question, we will then do so at the end of the first round. We go according to persons who logged in. So at this time, we will call on Paul Lopez from Plus TV. If you could open your mic and ask your questions, Paul.
Yeah, hi, good afternoon. Thank you to the head table. I appreciate this conference. I appreciate being part of the conference. My first question, Minister of Home Affairs, you spoke about this delicate balance between economy and COVID containment. And of course, it's a risk to open up places like gyms and churches that are considered to be high-risk spaces. When considering gyms, you consider the breathing, heavy breathing in churches, you consider the singing, etc. What went into these discussions while seeking to arrive at these delicate balances? Can you elaborate a bit on what went into that?
Yes, certainly, Paul. Thank you for the question. Very good question. As you know, under the previous regulations, we did have provision, and they still remain to this day, under these new provisions, for non-contact sports to be allowed. So running and cycling and what have you, table tennis and tennis, anything that does not involve contact has been allowed and continues to be allowed. And so when you look at gyms, we were able to determine this is not a contact sport. And so how is it that we can strike that balance to allow businesses, again, it's also a business, you have to look at it from the business perspective, to allow these businesses that have invested so much money in all their equipment, you don't want that to go down the drain, but at the same time, you want to allow them to open in a very responsible manner. And so that is why we determined 50% capacity would be an appropriate starting point to allow 50% capacity. And of course, other regulations like testing individuals coming to your facility, making sure that they don't have a high temperature, sanitizing and spraying and keeping all of the equipment safe for use. Every time somebody uses a particular piece of equipment, it must be sanitized thereafter. And so these types of regulations help the business to operate in a very safe manner. And so I just want to repeat that while you are exercising in a gym, you still have to maintain social distance. That is not removed. So those things are still a part of the law. While it is gyms are reopened, we are doing so in a responsible manner of 50%. And of course, the gym has to be ventilated. So those are the types of things that we factored in this particular consideration.
And I wanted to ask a follow-up on that, just to ask about oversight, if there will be any at gyms and even at churches. I understand that, well, maybe this was under the previous administration, maybe I'm getting my times mixed up, but in terms of the JPs, but in terms of oversight, what is there in place for oversight to ensure that gyms and churches and restaurants, etc., are keeping in line with these regulations?
If I may beg pardon on the part of Mr. Paul, Mistress of Ceremonies, that should not count as a second question for him, because that is something that I should have addressed. Like I said, all of those regulations remain in place. The regulation that we had provided for the justices of the peace to provide oversight to businesses still forms part of these regulations. Now, remember when we implemented it in December, on December 17th of 2020, we were in the height of the Christmas season, and all of the businesses were having this mad rush, huge crowds in various supermarkets and the stores. And so we saw the need for it at that time. And so while it is a part of these regulations and we continue with them, we will be monitoring it as a police department to determine on a case-by-case basis if we notice that gyms are becoming overcrowded. For one, they should not, because they are to abide by the 50%. But if we get information that a particular gym is offending the regulations and having 75% capacity, then the law provides for a JP to take over and to supervise and have oversight at those facilities. So, like I said, it is still in place. And if it becomes necessary, we can still have the JPs have the oversight at those facilities and the stores.
Can I just add?
Thank you for defending my questions, Minister. And so for my second question.
Just a moment, Paul. Just a
One
moment, Paul. I have the minister who wants to provide comments as well.
Yeah, Paul, if I may just add to that, the Ministry of Health and Wellness will retain the jurisdiction to do random checks on these businesses and churches to make sure that they are in compliance. So that would be in addition to what the regulations provide for.
You can proceed with your second question, Paul.
All right, great, thank you. So for my second question, this goes to the minister, and it has to do with the vaccines that are scheduled to hopefully arrive within the first quarter, at least at the end of the first quarter. I know that WHO issued a release recently which stated that they would be launching a country readiness portal by the end of this month. And they say that the portal is a vital step before allocations can be made to ensure that delivered doses are able to be effectively deployed and to identify where, if necessary, further support is needed. So basically this, they explained that this country readiness portal will allow participating countries to submit final national deployment and vaccination plans. So I wanted to ask if our national deployment and vaccination plans are prepared, and if so, are you, Minister Shabat, able to give some details into that national deployment and vaccination plan?
Yes, I am happy to say that we have a team dedicated at the Ministry of Health and Wellness who are looking particularly at the vaccines and the national plan and the deployment of the vaccines. We do have in our hands the national plan, which we are going to be sharing with the cabinet before we make it public. But I can tell you definitively that it is drafted and it is ready to go.
Okay, thank you, Paul. At this time, we will call on Aaron Humes. Just as a reminder, we have Miss Elisa Montalvo, who is also at the head table, if persons have questions for her. When the reporter is up, can they please give their name and the name of the media house they are representing before asking the questions? Mr. Aaron Humes.
Okay, thanks. Good afternoon, Ministers Shabat and Musa. I already have one question coming in from those who are very happy, of course, to hear that the churches are reopening. But there needs to be a bit of a clarification as to whether that 50% represents the capacity of the building or the capacity of the membership. And then in terms of the time that you're allowed inside the church, 1 hour, we know of Provision that time. So is that starting from when you gather or when the actual service begins?
Yes, thank you for the question, Aaron, and it gives me a good opportunity to clarify another issue that I should have mentioned in my presentation. And so, yes, it is 50% of the building capacity. Because if you get 50% of the membership, you might have 3,000 people in one church. So let's make it very clear. 50% of the building capacity is what is meant by the legislation. On another point that I want to clarify, while it is that we are allowing for church services to continue, and it starts from the point of when the service begins until the service ends, 1 hour from when it starts to finish. So if it starts 9:15, it ends 10:15. But the other point that I wanted to clarify is that even though churches are allowed to have service, weddings are still restricted to 10, and funerals are still restricted to 10. But you might say, but why? Well, there is a lot of imbibing that takes place at weddings, and there is a lot of close contact that takes place at funerals. And so it is necessary to draw that distinction that while a church service can have up to 50% capacity of the building, weddings and funerals are still limited to just 10 plus the priests and staff. So I just wanted to make that very clear.
Okay, thanks. And then on the issue of sports, we saw the situation last week with the national football team that what was it they call it? That fitness test in Belmopan, and that had to be cut off. I may ask to check with you is to whether that national team, which goes into qualifications for the World Cup starting in March, will they be allowed to practice within a bubble? That is from, I should say that's from directly the president of the Football Federation. So not sure why he couldn't ask you himself, but he's asked me to ask you.
Yes, I appreciate the question. It was a matter that was considered, but the truth of the matter is we cannot allow for contact sports at this time. And as you know, football is a contact sport. And so while each player may be allowed to train on their own in terms of exercise and what have you, they are not allowed to play as a team because that is a lot of contact sports. And it's not as though they're going to remain in a bubble. They do go home to their families. But there's nothing preventing them from traveling and taking part in the sporting event. It is just that we have to have that restriction continue on contact sports. If we do it for football, then we'll have to do it for basketball, then we'll have to do it for rugby, and what have you. We're opening a can of worms at that point in time. So again, the restriction remains in place, non-contact sports only.
Okay, I had one more for Minister of Health, and that will go, I guess, in the next round, no?
Okay,
Thanks
thank you,
very much.
Aaron. Thank you. Next, we have Mr. Jules Vasquez.
Hi, am I up?
Yes, yes. Go ahead, Jules.
Okay, good. Yeah, okay, I apologize. Yes, good afternoon. Jules Vasquez from Channel 7. I hope, Mr. Minister Musa, you will be as indulgent and as you were with Mr. Paul Lopez when I ask a follow-up or two that it not be counted against my very preciously small total. The first question I would like to ask, where are we in terms of in terms of tourism since the border is being opened at the free zone? The free zone is being opened and it requires people crossing the border. Is there any thought of opening the border itself? Because free zone hotels will be open, I expect. Is there any chance of opening for tourism the borders with similar protocols that are being observed in the free zone?
If I can take that question. At this time, we are not opening the land borders. Whatever movement is coming in from Mexico is going to be restricted to business owners for the purposes of initially ensuring that they are in compliance with the regulations to be able to open their businesses. And then it will just be extended to possible customers of the free zone. But we are not opening the borders for entry into the national territory beyond the free zone.
Okay, on another question, what is the continuing prohibition for bus transport? Are they still limited to 75% of passengers? I ask because you know, or you will know, that the price of diesel has been continually going up, and it has cut severely into the margins of these operators.
Yes, that continues to be and I'm sorry if your message, your question was intended for the Minister of Home Affairs, but absolutely the limitation for public transportation remains at 75%, and I can say very clearly that continues to be one of the areas of great concern for the Ministry of Health and Wellness, because we see many violators. We continue to see buses being loaded with more than the 75%. We see terminals that continue to be overflowing with individuals. And so at this time, we are continue to limit at 75%.
Okay, I have another question, but like Aaron, I will wait for the next round, which may be a fantasy, but
Thank you, Jules. No, we will come back around, I'm sure.
All right.
Thank you. At this time, we now call on Marisol Amaya. Marisol.
Hi, good
Yes.
afternoon, Marisol Amaya, Crim News. My first question is, for how long will the curfew be in effect this time around?
30 days.
Sorry, could you repeat? I didn't hear that well.
It will be in place for 30 days.
30
30.
days. 30.
30.
30 days. Okay, awesome. The next question, I'm hoping that Minister Shabat can answer this question. How long before we get back results on other strains of the virus possibly being in Belize? I know it was stated previously that they have sent out samples for testing in collaboration with an institution in the US.
Yes, that is absolutely correct, Marisol. We are actually expecting results over the weekend. And so depending on what those results are, we'll be able to share them later on in the early part of the week.
Thank you, Marisol. Next, we have Mr. Dion Vanson. Yes, go ahead, Dion. Hello, are you hearing us?
Yeah.
Mr. Vanson? Could you unmute?
Hi, hello everybody. Good afternoon.
Good afternoon.
I'm Dion Banson from the San Pedro Sun, and I have a question regarding the curfew for children. The one that it remains 6 p.m. to 5 a.m. What about there are some parents that work late and have to pick up their kids after work. Will kids be allowed to be with an adult after 6 p.m. or will the curfew, the regulation continue that they are supposed to be at home at 6 p.m. and not with an adult, or will they be allowed to be with an adult?
It's a very good question, Dion. While the law says that the minors have to be inside by 6 p.m., we are very aware of, exactly as you had indicated, that there are a lot of parents who have to pick up their children, whether it's from a grandmother or a babysitter or what have you. And so in the police department, when it comes to the enforcement of this particular provision, we have requested that police officers exercise their discretion as it relates to this particular point. Because other than that, there should be no reason. And so if you're going to the supermarket at 7 p.m., your child should not be with you going to the supermarket. If it is that you are on your way home, like I said, picking up your child after work to take them home, that's a different situation. And we are mindful of that. And that is why we have asked police officers to use their discretion in that particular instance only.
Okay, thank you. I have one more question regarding businesses. Since here in the island, tourism plays a big part when it comes to business. Also, back to that question about children. Can children be, like a tourist family comes to the island? Can children be with a tourist family, or they have to stay in the hotel?
Well, again, I'm not a fan of having different rules apply to different locations across the country. I like it across the board. Belizeans and tourists, the same applies. And so if the tourist comes with their family and their young children, then you can have dinner in your room. You can have dinner at your hotel. You're on your premises. And so they are not to be out after 6 p.m. Because they're not falling under that scenario that I just outlined is the only scenario where the child can be out, if it is that you're picking up your child to go home.
Okay, thank you.
Thank you, Mr. Vanson. Next, we have Ms. Renee Trujillo. Ms.
Hi.
Renee?
Hi, yes. Are you hearing me? Because I'm having some serious issues getting clear audio from you guys.
Yes, we can hear you well, Renee.
Okay, I want some clarification for benefit of the public. We have the amendments of these regulations coming about, but I want to touch, and this is for the Minister of Home Affairs, on the enforcement of these regulations. Many times when I'm rushing home from work, trying to beat the curfew, you see lines of customers, particularly on Freetown Road, including police officers, who are not practicing social distance. The popular fried chicken place here on Freetown Road, some of the Chinese establishments on Central American Boulevard, and there's not the proper mask wearing, there's not social distancing, and some of these very same culprits up to last night are police officers. And so I want to ask the Minister of Home Affairs in terms of enforcement, not only for the public but for the officers as well, what measures is being taken or are being taken in that regard?
Thank you for your question, Renee. Very good question. Like I said in my opening, I am very thankful to the majority, the significant majority of Belizeans who are law-abiding citizens, who follow all the protocols, follow all the measures. That does not mean that we will have 100% compliance. Hence the reason every Monday morning you hear our Commissioner of Police give reports of hundreds of Belizeans who are charged under the quarantine regulations. And so what I can say is that we are enforcing. It might not be at the very moment that you are seeing it, but if somebody reports it and a police officer is in the area, and the individuals who are not wearing their masks or not social distancing are being charged, which is why, like I said, we have hundreds of individuals being charged. Now with the new ticketing system, who knows, maybe the government will be getting some good revenue shortly from all of these ticketable offenses. So while it is that the ticketing system has been reduced in terms of the maximum fine from 5,000 to 500, we may very well see more income for the country going to the Consolidated Revenue Fund, because these tickets are going to be issued now even more regularly, in my opinion, than the arresting and detaining and processing of individuals. And so you can expect to see greater enforcement as we move forward using the ticketing system.
Okay, and then clarification on two aspects of the regulations. One has to do, as you are aware, there was that incident in Kikaker with the American National, the tourists. And so I want clarification on that, because what the commissioner says, was basically you are only allowed to lower your mask in public if you are taking medicine or water. I wanted some clarification on that. And the second aspect would be social distancing in small groups. Let's say, for example, me and two of my colleagues are walking down the street. I mean, it may seem a bit ridiculous, but you can't be too careful. Are we expected to still maintain that 6 feet social distancing?
Starting with the latter, yes, you are required to always be 6 feet apart from people who you are with out in public. When you get inside a premises or a home, that's different. But out in public, we are asking everybody to maintain social distancing, especially at business places. Like I said, the law already provides for markers to be outside, and so we'll be looking at that very carefully, like the business on Freetown, that individuals are spread out properly, or else you'll be ticketed. In relation to the incident that happened on Kikaker, what I can say about that particular incident is that the officers were interpreting the law very strictly, because the law does not provide for anybody to be taking off their masks and eating in public. You can take off your mask and eat inside a restaurant, but you're not supposed to do that out in public. But again, the officers have been asked to use their discretion. And so I'm not going to sit here and chew off my officers' heads that were out there in Kikaker doing their job, because the law doesn't provide for it. Other officers may have used their discretion in a different manner. And I think when it comes to tourists, I would want to say we are to treat all Belizeans the same as we treat all tourists, with good customer care. The police officers are out there working for us, the citizens of this country. And so they are to show good customer care, not just to tourists, but to Belizeans as well. And so a Belizean may be diabetic, or a tourist may be diabetic and may have to eat at that very given point in time. And so we have to use our discretion. And so that's the only thing that I could say in relation to that particular incident. It is a case study on the use of discretion. I personally would have used my discretion not to charge. That's just me, but other officers may see it differently. We are told that the individual was warned, even, was given several warnings. So all of that we don't know. So we have to look at all the circumstances as it surrounds each particular case.
And sir, just as a point to note here, I was just sent a picture of a commuter's bus coming from Orange Walk to Belize City right now with 10 people standing.
That's
So
illegal.
and there's
That is
so where is
illegal.
the
I would
enforcement?
want to tell you to call 0800 parties. There's a party on that bus. And so somebody should report it so that we can deal with it. It is illegal.
Thank you, Renee. Next, we have Mr. Dwayne Moody.
Right, good afternoon, head table. My question is for the Minister of Health and Wellness in reference to the COVID variants. Is there a planned response prepared by the ministry should, in case one of these variants make their way to Belize?
Yes, Dwayne. As we said before, we're tracking this very closely. We have actually taken the step to send out swabs to be tested. We anticipate that we're going to be getting results over the weekend, and depending on those results, we already have in place certain measures that we may need to implement right away. As you all know, especially the UK variant is known to be, it has a very high rate of infection, much more higher than the current strain that we know of. And so, yes, at the Ministry of Health and Wellness, we are prepared should we find that the variant is now in Belize.
Thank you. And then for Minister Musa, sir, just in reference to, and almost as a follow-up to what Renee had said, in terms of enforcement and ensuring that there is no, with this ticketing system, and ensuring that there is no abuse on the part of law enforcement officers who, are tasked with issuing these tickets.
Yes, good question, Dwayne. As you know, no particular law is foolproof. Everything has its pitfalls. Like I mentioned, I believe it was Courtney Menzies from Channel 7 that asked me the very same question at the first press conference. And as I indicated to her then, to me, the current law allows for greater abuse because you, Dwayne, if you are going to be given the option of, I will charge you, I will take you to the Queen Street Police Station, I will hold you until tomorrow, that to me is a greater threat on you, Dwayne, than a ticket. And so the current regulations right now are a greater opportunity for abuse because holding somebody's freedom over their head as opposed to a ticket, it's a greater threat to abuse, in my opinion. And so I could see it actually lessening with a ticket, that you won't have as much abuse as you do currently. Not to say, but we have to remember that there is a professional standards branch. And so if anybody is the victim of any abuse, of any extortion by any police officer, I want to encourage those individuals to make a formal complaint to your district professional standards branch bureau so that we can look at those complaints and we can take action with respect to those complaints.
Okay, thank you, Dwayne. Next, we have Mr. Alberto Veos.
Hi, good afternoon, members of the head table. The issue of the Corozal free zone is both positive and negative in terms of the employment and the concerns with regards to the re-entry of COVID-19, especially to the Corozal district. Can you discuss that in detail, or as much detail? What specific measures have been put in place to detect possible cases, and should we be concerned mostly about the asymptomatic cases that might be coming into Belize?
You have the list?
Okay. 1 second.
Yes, there they are. Yeah, we have put in place certain measures that we are going to be requiring Ms. Taveos, including temperature screening, a logbook to keep track of all persons entering into the zone, the installation of wash-hand basins, strict enforcement of the use of masks and the social distancing, a designated transport for employees, no more than 75% capacity. There is going to be constant vigilance by our public health officers. There is going to be testing, and we're limiting the restaurants in the free zone to outdoor dining alone and to the 50%. The hours are going to be limited to from 8 to 6 p.m. The casinos will remain closed. And so these are some of the measures that we are implementing in the free zone to try to be as safe as can possibly be in the circumstances.
The second issue to that question had to do with the asymptomatic cases. Is there a concern, is it a real concern that these cases are not detectable, because we know the situation with asymptomatic?
Well, they are detectable. They are detectable, not because you're in some asymptomatic means that it cannot be detected, and that is why we're going to be having testing in place to capture those as well.
Just as a clarification, does it mean that patrons coming into the zone will be tested?
There will be random testing of everyone entering to the free zone.
Okay, thank you.
And I want to just make clear that while the testing will be random, the temperature, the taking of the temperature will be for everyone entering into the free zone, and so that if your temperature is elevated, you will either be quarantined or denied entry into the free zone. So as we have said earlier, we're also undertaking a massive education campaign about testing, and not only will we be testing people coming into the free zone, but across the country, we continue to expand our testing.
Thank you, Minister. The second question has to do with the difference we have seen prior to when the previous regulations were implemented and these new regulations. Back then, you had specifically said that the rate of transmission for Corozal and Orange Rock was 1 to 15. Can you speak about how significantly that has reduced?
Well, I shared the numbers. I did not share the positivity rate earlier, but what I did share with you was the significant drop in the number of cases, no? And I am sure that I gave you we're way down to where we were. I had listed those numbers, and I can repeat them if you wish. In December, when we started with the SI, we had 1,073 cases in Belize City. We're down to 348. In Cayo, we started with 983. We're down to 273. In Corozal, 495. We're down to 62. In Orange Walk, 625. We're down to 66. Stan Creek, 452. We're down to 128. In Toledo, we started at 368, and we are down to 152. And so you see that we have had a significant drop in the numbers of positive cases that we have been seeing. Unfortunately, let me see, we started, I have the RO for Corozal and Orange Walk. When we started with the SI, we were at 15. We're now down to 2, which is a significant improvement of where we started in December, on December 17th. I wish I had the RO for the rest of the countries, but unfortunately I do not have them. If you want them, please contact us and we'd be happy to share them with you.
Thank you, Minister. Just asking the MC not to forget me in the second round of the question.
No, no. We're coming back around. Thank you, Mr. Vayos. Last but not least, we have Mr. William Isigiri. Mr.
Hello,
Isigiri?
can you hear me?
Yes, we can. Go ahead, William.
Fantastic. Minister, I covered 25 different sports disciplines, almost as many letters as in the alphabet. And all your listeners out there who I am giving them voice are very concerned about the issue of what you define as a contact sport. I speak with respect to runners and cyclists who are alone on the road, whether they're on foot or on machine. And when you cross the finish line, I could tell you that the runner it's a very lonely sport. All right? So right now they're being allowed to train, but there haven't been any competition events allowed. Significantly also with cycling, the issue there is that cyclists tend to get close to each other to trail in each other's wind. But the issue there is at the finish line, they're alone. As we've seen in several recent cross countries over the last few years, the winner came in all alone. Therefore, what is the definition of
Mr.
contact
Isigiri?
with regard to these, and will racing be allowed for runners and cyclists? That's my first question.
Yes, sure.
Good afternoon. Thank you for your question. I don't think it's a matter that that the runners, because it's a non-contact sport, it's being restricted. It's that they're restricting all competitive recreational events. And the reason they're being restricted is because that will gather crowds. And so you are allowed to run, you're allowed to exercise, you're allowed non-contact sports, but you will not be allowed to have them in competitive nature because of the gathering.
Okay, now, for my second question, particularly with regard to team sports, I would like the minister to clearly define which sports are defined as contact sports and which ones are allowed. I'm thinking of specifically volleyball. There's no actual contact between players. You make contact with the ball. And in fact, in the past, last year, the issue, they say allowed as many as 3 players on each side of the net for indoor volleyball. As far as I know right now, only beach volleyball is being allowed because it is played outdoors. All right. So I know all my friends in the volleyball community would be interested to know if indoor volleyball in any form would be allowed. Another part of this question is other sports. For instance, softball, you need to tag the player to get an out. That is contact. But in the case of cricket, all right, the player fields the ball. He throws it to the wicketkeeper, and that's an out. All right? There is no contact between the team that is fielding and the 2 batsmen who are batting. If you're out, you're out. The ball is caught, you're out. Case closed. All right? There's no need to tag. So there is strictly definition, there is no contact between any of the players. Is cricket going to be allowed, provided they don't have any fans? And the other issue there would be, what about in the case of a team that is as one unit? For instance, at the CONCACAF level of football, the entire team, they're tested, that the organizers are sure that every single player, coach, manager, trainer, every jackman rabbit on that team is negative. and they're allowed to play in a stadium against the other team who have also been screened in a similar manner, and all the referees on the field also have to meet this criteria, and the game plays, no fans. Would the Ministry of Health and Wellness consider such a format for football to occur in Belize, particularly in the nature of that our team needs to prepare for World Cup qualifiers? Would that be countenanced?
All right, thank
That's
you.
my second question.
Thank you,
for-
William.
Thank you for your 15 questions, Mr. Ezegiri. Let me try to answer it as best as I can. So, you've made very convincing arguments that cricket is not a contact sport or may not be a contact sport, but I've seen contact in cricket. When you're trying to run to the other wicket, I think wicket is the name of the thing, and then you're trying to out the person, there is contact. So it's not as much contact as basketball and football. I would agree with that, but there is some contact. And so the law, like I said, remains the same from the last occasion. You are allowed to run, you are allowed to cycle, of course, within the requirements. You are allowed to play tennis, golf, table tennis, and any other similar non-contact sports. You mentioned volleyball, and I am a huge fan of volleyball, and I would want to see volleyball come back as well, as much as you would. But at the end of the day, you can't deny it is a contact sport. There is a lot of contact in volleyball. So again, not as much as basketball and football, but there is contact in volleyball. And so, like I said, the law remains the same as previously, non-contact sports only.
Thank you, William. Like I know most of the reporters are asking for a second round, so we start from the top again. Mr. Paul Lopez, do you have an additional question for the panel?
Yes, I do. Thank you. Just for clarity to the head table, in terms of churches, what does the regulation say about children attending churches and about mask wearing in churches? And then I think about how do we define what is 50% of a congregation in instances where, for example, the churches may meet on a large compound and 50% might be 150 or 200 persons.
As we have said before, it is 50% of the physical space, and notwithstanding that, you must adhere to all of the public health measures, meaning that there must be social distancing among your churchgoers. Masks must be worn at all times. The church should ensure that at the entrance of the church, there are facilities either to spray hands or to wash hands. Again, this is not, we're not throwing out the baby with the bathwater here. This is just a modifying of the rules, but the basic public health measures remain in force. The wearing of masks, the social distancing, the washing of hands, all of these remain in force, and all of these are applicable to churches, gyms, and all businesses that are allowed to open.
And the question of children, are children allowed to?
Children are allowed to go to church. The prohibition is being out on the streets after 6 p.m.
Thank you, Paul.
Thank you.
Mr. Aaron Humes, you have an additional question?
I had hoped to have, hello?
Yes, go ahead. We're hearing you.
Yes, it was really two.
No, Aaron. we'll take one.
Okay, so I'm only getting one, right?
The best
Fine.
of your two questions.
All right, I'll ask the Minister of Health, since I had said it was going to be for him. Has the ministry authorized specific herbal and or natural treatments for patients with COVID-19? I think you've heard people talk about the vervine plant, and then there are others, vitamin D, for example. What is the specific course of treatment that patients with COVID-19 get, and is there anything sanctioned by the ministry with regard to that?
We have not authorized the use of any natural medications for the treatment of COVID. So I'm not sure where that concern is coming from, but the ministry has absolutely not authorized the use of any. We continue with the regime that we've been using, and as I said back in December, we have included in our regime both ivermectin and remdesivir.
Okay, thanks very much.
Thank you, Aaron. Jules Vasquez, if you have an additional question.
Yes, thanks so much. Okay, I'm trying to understand. I know a lot has been made about children and the prohibition on their movement, and I'm trying to get to a conversation about schools. And you all will know, certainly the Minister of Health, who keeps up to date on his medical journals, will know that the Centers for Disease Control has put out its most recent understanding of how the virus propagates in children. And it is that really children are at the lowest risk for spreading it and at the lowest risk for contracting it, assuming safety measures are taken. What is the thinking as it relates to the ongoing prohibition on school, and knowing that this also has socioeconomic and socio-cultural effects?
Yeah, thank you for the question, Jules. At this time, at the Ministry of Health and Wellness, we are continuing to monitoring, and we are not yet convinced that it is time to open our schools. We are in conversation with the Ministry of Education and to make sure that we have the proper data to be able to analyze properly when that start date or that resumption date would be. But currently, at the way we stand, we are not yet prepared to give the green light for school to resume.
If Claudette would be so kind, I do have a follow-up, but it's a follow-up to something I asked in the last for the Minister of Home Affairs, because I know how indulgent he is of follow-ups. Sir,
I feel like you're going to speak
about
over
the
me.
northern free zone, but are there any plans for the western free zone, since you said that you like to apply things equally across the board?
Well, that has not been brought to the table as yet. The opening of the western free zone is not something that we have brought to the table as yet, but not to say that it will not come in the near future. Of course, it is good to see where we are with this particular reopening. The Corozal free zone has far more business interests per se than the western free zone. And so if it is that we are able to succeed and there isn't a huge spike coming out of this first reopening, then we can look at the western border as well. So it is certainly a case study as we move forward with this particular reopening, but we haven't considered yet the reopening of the western border. Or the western free zone, let me clarify, not borders. No border is open right now.
Thank
no
you,
land
Jules.
border.
Thank you. Next, we have Ms. Marisol, if you have an additional question.
Yes, thank you. This is for the Minister of Health. How are we doing now in terms of turnover to get back test results, and how is the forwarding of results from the private sector to the Ministry of Health working? What percentage of the results are split between the private and public sector? Thank you.
Yeah, the giant share of the results are still coming from the public sector. They're still coming from our public hospitals and institutions. In terms of reporting, we do have a platform that we have shared with those testing facilities, those private testing facilities that have been licensed, and through that platform we are receiving their data. I am happy to report that we are down to 24 hours in terms of a turnaround in getting back your test results. I can tell you that this is something that we're very proud of. When we first started, we were looking at somewhere of an average of 30 days before you got back a result. And so we're now down to 24 hours for you to get a result.
Thank you. Mr. Vanson, if you have an additional question.
Yes, ma'am. Thank you very much for the opportunity. In terms of restaurants that are allowed to open, is this limited to open air facilities only, or also indoors can restaurants that only have indoor facilities can also
Yes.
can they have to open?
Good question. The law as it relates to the opening of restaurants remains the same. Open air, al fresco, outside dining. That is what the law provides. If it is that the restaurant is an indoor one but has windows that are open and there is sufficient cross flow of air, sufficient ventilation, those particular restaurants are allowed because they're considered open air, so to speak, because of the cross flow of air. So I hope that clears it up for you. But if you don't have that type of cross flow of air, then in fact you cannot open at this time and cannot have 50% of capacity in your restaurant.
Thank you. Ms. Renee has already indicated she has no questions, so I will now call on Dwayne Moody.
Thank you, Claudette. Minister Musa, just to follow up on that question that I had in the first round, when it comes to the ticketing, the time to pay, will there be a time in place for them to make payment? And for non-payment, is there a penalty?
Yes. Okay, let me just elaborate on the ticketing for you there, Dwayne. Every person who is issued a violation ticket shall pay a fine of $500, which amount shall be clearly stated on the face of the violation ticket. Every person issued a violation ticket shall pay the fine stated on the ticket within 15 calendar days of the date of the issue of the violation ticket. The fine stated on the violation ticket shall be increased at the rate of $10 for every day that the fine remains unpaid. If the fine stated on the violation ticket remains unpaid for a period of 30 calendar days from the date of issue of the violation ticket, the ticket shall automatically operate as a summons, and the person to whom the ticket was issued shall on the specified day in the summons appear for him to appear in court. So essentially, it is a $500 fine. You do have 15 days within which to pay the fine. If it is that you want to challenge and you want to go to court and challenge that you were, for instance, you were wearing your mask on that particular day and the officers ought not to have given you a ticket, then you can appear in court on the day that is set, because there will be a day set there as a summons. So when you are given this ticket, you will see the fine on it, $500. You will see a notation that it will be increased 10 days after, $10 a day after the 15th day. But you are going to be given a court date if it is that you want to challenge that particular ticket.
Thank you, Mr. Moody.
Thank you.
Mr. Alberto Veos, if you have an additional question.
Thank you. Actually, I do, Ms. Dakers.
Thank you.
I had multiple, actually, but
We'll only allow for one more.
perhaps the biggest thing for Corozal ministers, apart from the Corozal Free Zone, is the intended opening of a water park business. It has both proposed activities, business activities on land, and proposed business activities on water. Do you foresee that either of those might present challenges, and what would be the regulations that will fit that type of business activity?
Well, when it comes to, I'm not familiar with the exact business you're speaking of, but it would have to be subjected to the very same regulations like everywhere else. If it's a restaurant, 50% capacity, it has to be open air, the restaurant. if it is that their patrons are allowed to swim, those patrons have to, at all times, be 6 feet apart from each other, have to be wearing masks. I know there is no requirement to wear masks in the water, so we have to respect that. But that might be one of the businesses, Alberto, that the Justice of the Peace may very well have to be posted if it is that we are getting complaints that there is not enforcement of these regulations.
And the water park aspect of it, that would be on water?
That's what I'm saying, that if it is that the patrons are swimming at this particular establishment and there is not proper observance of the regulations, then it may require oversight by a Justice of the Peace to ensure that the patrons are observing all of these measures.
Okay, thank you very much.
Thank you, Mr. Vales. Mr. Isigiri, while I know you had asked, according to Minister Musa, 15 questions, I'll be fair and ask if you have one last question. Please have it be one question, Mr. William.
Okay, can you hear me okay?
Yes, we can.
That was your question, Mr. William.
Thank you.
Yes.
All right,
Next.
no, no,
I'm joking. I'm
All
kidding.
right,
I'm kidding.
Go ahead.
There are some other sport disciplines who will be concerned about what's allowed and what's not allowed. I know the other day we were very proud of 11 athletes, 11 medals that he won at Central American Championships, including 2 gold medals. All right. And we have an athlete that's going to be representing us in the NFL Super Bowl. I mean, that is unprecedented. We have several other international events that are traditional, a part of Belize, coming up in the next few months, notably the Ruta Maya scheduled for the 9th of March and Holy Saturday cross country. Now, we've already heard about cycling. What about canoeing? The distance between the paddlers and the canoe is fixed. They don't jump out of the canoe or in any other way make contact. They have the paddle in both hands and they're paddling. Canoes don't normally make contact with each other. All right, so that doesn't fall in the definition of a contact sport.
That's your question, Mr. Isigiri.
All right,
That's your question.
Let me answer because I think I see where you're
going. It's not a contact sport and which Belize is a defending world champion. Mayan ball, puck to puck, all right? Where players make contact with the ball with the hip or their head. They are not allowed to touch it with their hands or feet, all right? And they knock the ball from one side of the court to the opponent's side of the court and back and forth. But players do not make contact with each other. They only make contact with the ball, which is a hard, solid rubber ball. It's not inflated air like a football. It is solid rubber, and they have to hit it with their hip or their
Thank
head
you,
if it
William.
bounces.
We got the question.
Right.
Sorry.
So,
yes, Mr. William, I appreciate your line of questioning. You are a fierce defender of our sports and of our sporting techniques in the country. We were just properly educated by your good self on the Pokatok. And so what I want to say is this, Mr. William. We are in the fight of our lives right now. Let us not forget that. The only championship Belize wants to win right now is the COVID championship. That is all we're focused on right now. I fully appreciate what you're saying. We're in the year of the vaccine, you know, Mr. William. Hopefully we can get the vaccine soon. Hopefully we can get back to all of these different sporting events. We're all looking forward to it, just like you. And so we just have to bear and be patient a little while longer. That is all we're asking. And I agree with you, there's not much contact in canoeing, but at the end of the day, it's a huge festive event. I think Boyne and Boyne is the sponsor of the event, so you know a lot of drinks will be there. So in addition to contact, it could get out of control. So I just want to say that at this point in time, we're not looking to reopen those particular events.
Thank you, Mr. William. So that ends our question and answer segment. And while we are live and situations and information is dynamic, the Minister of Health and Wellness, Honorable Michelle Shebat, would like to take this opportunity to share on additional information or clarify on that information. Minister Shabat.
Thank you very much, Claudette. It's really just to close the press conference, and really just to remind the public to please continue adhering to the public health regulations. Please remember social distance. Wear your mask. Please wash your hands properly. Please reach out. Go to the testing sites. It is important to know what your status is. It is important for us at the Ministry of Health so that we can plan. Our task is to save lives. Our task is to ensure that we do the best that we possibly can for our citizens, and we continue to plan, we continue to monitor, and that is our objective at the Ministry of Health and Wellness. And so I want to thank you all for tuning in this evening. I want to thank the Honorable Karim Musa for joining us, and Ms. Elisa Montalvo, our Solicitor General, who has worked hard, who has been working very hard to help us put all of these regulations together. And so as we close, please remember, wear your masks, 6 foot distancing, wash your hands. Thank you very much.